Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Hi, and welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. As always, I'm Hope, and I'm your host. Today, joining me as my co-host is Tara. Today, we're talking about menopausal hormonal therapy, what it is, how to learn more about it, and who to go to for treatment. We're excited to learn more about that, but I'm going to let Tara introduce our guest today.
We are so excited to have Shelby Morrow here today. Tell us a little bit about what you do here at Tanner Clinic.
Thanks so much. I'm excited to be here. My first podcast ever.
Yay.
So exciting. But I'm a physician assistant that works at the East Layton Clinic in family medicine. And I am really interested in helping patients feel heard and understood and that their concerns are worked up appropriately. And I've taken a kind of a special interest lately in women's health, and particularly with, as you may guess, hormone replacement therapy for after menopause, but also as far as like mental health and bone health, osteoporosis, those types of things. So I'm your run-of-the-mill family medicine PA. But
Well, thank you for taking an interest in something that will affect me. So
you're welcome. It'll affect all of us at some point.
right.
I know. I'm just waiting till the day I get there, but most women, they're going to love this episode, I think.
Yeah.
So
Hopefully.
Agreed.
yeah.
Hopefully shed some light on things.
Let's get started with my favorite segment that we like to call, Is This Doc Normal? And the first question that I have for you is, who is your favorite fictional doctor?
I don't know. That's a tough one. I would say I'm going to cheat a little bit. It's not necessarily a doctor, but I love the nurses on Call the Midwife.
They are, very good.
They are.
With what little they had back
That's true.
then.
So
the little-
empathetic.
Yeah.
And so, that's how all doctors and providers and nurses and everyone should be.
I think that's a great answer.
And all the women that went through natural birth at
Yes.
home back then.
Yes.
Well, and let's be
With-
honest, they, did a lot of it. The doctor
Yeah.
came in, there's only one doctor, but there's so many of the nurses that they were going to the houses and,
Yeah.
doing house calls and things like that. So
Yeah.
they did a lot of the grunt work, let's be honest.
As many nurses do.
Yeah.
All right. So if you could become instantly an expert on any topic, what would it be?
I would say one that just came to mind was space. I think knowing a ton about space, an expert, and I think that would be pretty cool.
And space is super unexplored.
Yeah.
I know.
So,
It's the final frontier, guys.
I know.
Yeah.
So it'd be even cooler if I knew everything there was to know about space, even stuff that experts right now don't know.
aliens are real.
It'd be pretty
believe
awesome to know.
Statistically, how can they not be?
Yeah.
My next question is, if you had a warning label on, what would it say?
I don't know. Probably I'm a Swiftie. That's probably what my warning would be. I'm maybe not as hardcore as some of the people are out there, but I do like to listen to Taylor Swift and think she's an incredible musician. So that's probably, in pop culture, probably deserves a warning label at this point.
You're like,
I'm a
warning,
Swiftie.
if you're going to be in my office, I will be listening to Taylor Swift.
Yeah, when her
so you're
album
just-
came out, I was definitely
So
playing
do you
it
know
in
the fate
office.
of Ophelia Dance?
Oh, no.
Because me and Hope did that for Halloween, so you have to look it up. We did our favorite.
I don't think I did very good, but it's
You
fine.
did amazing.
I should have prepped for that, yeah.
Yeah.
Sorry, guys.
We could have done it.
Tara made me learn it, and
Another episode, maybe.
There you go. All right. Would you rather have a toe the size of a foot or a finger the size of a hand?
I think I'd rather have a finger the size of a hand. I don't know why. It just seems more useful in some
I feel like
ways.
it's like an extended arm.
Yeah, it's like an extended
You
arm.
could get a prosthetic on it that is like a hand.
It would be harder to hide, so I guess if
And shoes, you don't put shoes
Yeah.
on your hands. So,
it's true.
Yeah.
I just wear mittens all the time. But if it's just one finger, I think that would be maybe a little cumbersome. You wouldn't be able to use it with the rest of the fingers.
Also,
very well.
the toe the size of a foot, would you have to get another shoe?
That's what I mean. It's like
You'd
just
be
the shoe
wearing a
just-
shoe, and then you
very
get a
extra
shoe for your
shoe.
toe.
Yeah.
So you'd
But
have,
your other
two
foot's normal. And it's just you just have one big foot. And then
Or
the
is
other
it instead of a foot, you just have a giant toe? The verdict is in, and I do have to say you are normal.
Is that a good thing or
Yeah.
a bad thing in the show?
I mean,
No, I've
fair.
never said anyone's not normal, but I feel like Maybe I switch my verdict for Dr. Hutchinson. If we're going back, I think maybe he's not normal. But other than that, everyone's been pretty normal.
Okay, I'll make sure to check in each week to see if you go back on my verdict.
We're going to move on now to the actual topic of today, which is the MHT, Menopausal Hormone Therapy. And we're going to start off with, what is MHT and who is it for?
So menopause hormone therapy basically takes estrogen and replaces it in your body, and sometimes progesterone as well, for when you're having declining levels after menopause. So those declining levels oftentimes cause a lot of symptoms such as hot flashes or vaginal dryness, some mood swings, sometimes decreased bone density. And so what we're doing is taking a compound or a chemical that is identical to what your body makes and just replacing it for you so that your body isn't as low as it would be.
Okay. I have so many questions, and I know we're going to get to them later, so I'll just hold off on that.
Okay.
But yeah, I'm excited to learn more about it.
Okay, so I feel like not a lot of people talk about this. So how do you know who is a good candidate for menopausal hormone therapy?
Yeah. So the typical answer is generally within 10 years after you start menopause, and if you're younger than 60 years old. Now, there's some caveats that we can get into a little bit later in the episode, some that might be on the extreme of one or the other. But generally, women who are going through this transition are usually complaining of these symptoms between the ages of 40s and 50s and are generally healthy otherwise. And so this hormone replacement therapy is very safe in that population. And, there are some things that we monitor and watch out for, but can really help with some of your symptoms.
Is it ever too late to start the hormone therapy? Like, is it ever too far gone for someone to start?
I would say if you are having symptoms that are causing difficulties in your life and impacting your lifestyle, you should just talk to your doctor about it. I don't say, typically we don't start it after the age of 60, but like I said before, this is a very individualized decision that you should have with your doctor. And if you feel like you could benefit it, then I think you should talk to your doctor about it.
That's just where you're going to get the most accurate, most
That's
personalized information for you. People always try and turn to the internet. And the internet doesn't know you as well as your doctor does.
That's
it
true.
doesn't know your medical history. So
That's true.
just go talk to your doctor. They'll point you in the right direction.
Yeah. There are some that aren't good candidates for hormone replacement therapy, specifically those who have had breast cancer before, those who've had like a heart attack or a stroke. And then there are some kind of considerations to take into account, those who have high triglycerides. Maybe, you choose a transdermal form of estrogen instead of an oral, or those with active gallbladder disease or bleeding or clotting disorder. There are a few conditions that I would say have a doctor pause before giving you hormone therapy, but you never know until you talk to them. It's like an infomercial, Talk to your doctor.
All right, what is the difference between bioidentical hormones and traditional hormone replacement?
So a lot of that has to do with pop culture and what things have been kind of thought of as bioidentical. Bioidentical estrogen therapy is technically 17-beta estradiol, which a lot of providers can prescribe. However, in pop culture, it has become a thing of, going to someone who checks a whole panel of all of your hormones and your testosterone and your estrogen and your progesterone and all these things. And then they try and kind of make a compounding version for you based on those results. And that's really not supported by evidence or recommended by many academies. Primarily because, one, it doesn't show that it works better than using very regulated, safe forms of estradiol. Two, a lot of these compounding forms are not regulated, and so you never know how much you're actually getting in some ways, and so they sometimes discourage that. And three, we have so many great options that are evidence-based that can help with your symptoms, and so I would say, bioidentical has kind of been thought of in the media as a kind of a more natural form. But in reality, 17-beta estradiol, which is easily can be written as a prescription, is bioidentical to the estrogen that you make. So it's kind of really just semantics and kind of what pop culture has made it.
I remember an Oprah episode about bioidentical from many years ago.
Oh, really?
I was like, that sounds cool.
What was Oprah's
Yeah.
take?
I just remember them talking about like they take what you were saying, they take your labs and they try to match what's missing. And
Yeah.
So yeah, but that was many years ago. And
Yeah.
they've probably done a lot more research since then.
It's hard because in 2002, a study came out by the Women Hormone Initiative. What it came out was this big study that said that estrogen therapy wasn't safe. But we've done a lot of research since then, and a lot of that study was studying women older than 65. And so it really scared off a lot of the population and doctors saying, okay, it puts you at risk for this, this, and this, and, you know, we can't be prescribing it. It's not safe. But in reality, when you're really looking at a little bit of a younger population that's still going through these symptoms and having these concerns, it is perfectly safe. You know, their risk factors are not as high because they're not as old and they don't have as many disease burden or other things that are contributing to it. So I would say bioidentical hormone therapy kind of came out after that era a little bit as an alternative, saying, well, you know, this traditional stuff might not be safe, but, you know, we have these special compounding pharmacies that make it out of soy or plants or things like that that are more safe, when in reality, the original traditional ones were safe, just not in the population that they were studying it for. Again, on the flip side, 17-beta estradiol is bioidentical to what your body produces. And so kind of just a misnomer and what kind of media calls it, and some old misconceptions about what is safe and what's not, based on an old research study that has since been disproven.
So where would you recommend a woman start if she is interested in this hormone replacement therapy? Is this something that she needs to see an OB for? Can she see her primary care doctor? You know, where is their first point of contact, do you think?
You know, traditionally people have been thinking of, oh, I've got to go to my OB or my gynecologist, when in reality, many primary care providers are very comfortable in prescribing it. So I would ask your doctor first, your primary care doctor, if that is something that they do, and if that's something that they can offer you. And if they don't, you know, then they can point you into a direction of either maybe someone else in their office that is a little bit more comfortable prescribing it, or refer you out to a gynecologist if needed. But in reality, most primary care physicians are able to prescribe it.
Okay, that was going to be my next question, is like, is this something that a lot of people are able to do and are knowledgeable in? So,
you know, I would say it's a area of growth that maybe not many doctors were traditionally trained in. For example, going through my program, I never learned about this. You know, it's something that I have been interested in and been researching and asking questions on my own and research papers and guidelines. And so I would say there is a large deficit of knowledge that medical schools or PA schools or NP schools or whatever schools are not teaching this in that they should be teaching it in ways that they should. And maybe they are now, but some doctors weren't taught it in medical school, and therefore they may not be as comfortable. But it's something that has a lot of evidence and guidelines and based on. And so a lot of us providers can learn more about it and become comfortable prescribing it.
does MHT really help with night sweats and hot flashes?
Yeah. I mean, that's kind of the main symptom, I would say, or the biggest symptom that it helps with. A lot of other symptoms may kind of fall along due to the hot flashes, such as poor sleep or others. But, you know, we tend to start off at a very low dose of estrogen. And so if that doesn't work within the first couple of weeks, I wouldn't say give up on it. You know, it's just something that your doctor maybe needs to increase a little bit, adjust based on according to your response. And so, but yeah, I do believe, and many women will testify, that it really does help with hot flashes and night sweats.
I'm feeling a lot of women are going to be really excited to hear that.
I hope so.
A lot of women are having a lot of sleepless nights due to that.
Yeah.
I think. So,
Yeah. Something that, you know, in those who are transitioning to menopause, 85% suffer from either hot flashes or night sweats, but only about 15% of women will go to their doctors and ask about it or ask about treatments for it. And so if you are part of that other, trying to do math, 85 minus 15, 70%. If you are part of the 70% who are not asking your doctor about it, there is hope. Go ask your doctor.
And that's great to hear that, because I think a lot of women honestly feel like they're just being dramatic, or it's like something that all women go through. So they should just suck it up and like just deal with it. They're like, oh, well, that's just the point I am in life. And it's just how I have to live now.
I mean, even if a lot of women go through it, doesn't mean that we don't have treatment options. I like to think of what are some conditions that most men go through, but may not ask about it.
Another podcast.
It's fine.
All right. So you mentioned sleep. So not just the hot sweats waking you up. A lot of times you're just not able to stay asleep the whole night. And also like it might affect your mood, because if you're not sleeping, then maybe you're, a little ornery all day. And then also maybe if you're not sleeping, you might have some brain fog.
Yeah. You bring up a great point, because, menopause doesn't only affect hot flashes. It also, during this transition time, you can get a couple of other conditions that require treatment. So, for example, there's an increase in restless leg syndrome as women go through menopause. And so there is an increase of depression and anxiety as women go through menopause. And there are other treatments, besides just hormone therapy that can treat these conditions. And so it's important to talk to your doctor about of saying, hey, I'm not only having hot flashes, but I'm having trouble sleeping or staying asleep. I'm having trouble with my mood. I'm having really, dark thoughts, or I'm not as happy as I usually am. Those are things that your doctor should work up and address and help treat. And sometimes the answer is hormone therapy, but sometimes it's not. And there are other treatment options that might be better.
Can I just say I'm really not looking forward to that time of my life. And I just really feel for the women that
I know
are going through that.
I
have women in my life that are going through that.
I feel for those women, but I don't want them to be scared of it happening. This is something that will happen and does happen to millions of women every year. But let's get through it together. Don't be scared or paralyzed by fear to prevent you from coming and asking for help, or asking to see if there's something that we can do to get through this time period.
I feel like there's like a movement of women's health and speaking out more. And because I feel like before, like a lot of women were suffering with like endometriosis or like different reproductive issues, and they were just told like that's normal. And as far as like menopause goes, a lot of women have just suffered through it. And I feel like I've noticed in the more recent, past that more people are talking about it and different ways that we can help with that.
And just because it's normal, or that it's normal for the body to go through that, it doesn't mean that there aren't treatments out there that can help.
Yeah.
So that it can improve your quality of life and help with symptoms.
On to even more exciting aging women issues does hormone therapy help with bone density and osteoporosis?
There have been studies to show that, yes, it does help decrease the rate of bone density loss. However, it is not approved for preventative cares. So, we wouldn't want, it's not recommended to give to you just in case you were to lose bone density loss. I'm going to say bone loss now.
I know. I did say that earlier. Sorry.
That's okay. So, but again, as I kind of mentioned at the beginning, bone density is another very important part of your health. And there are other medications that if you do have osteoporosis or osteopenia or low bone density, there are other medications that can help build that bone back up or help it from becoming worse. So yes, short answer is yes, it can help with it, but it's not usually used first line in treatment.
So you mentioned earlier vaginal dryness. Tell us more about how it can help with that.
Yeah, so vaginal dryness occurs when your body has a sudden drop in estrogen. If you are having vaginal dryness in combination with hot flashes or other symptoms, typically your doctor will recommend a oral or a transdermal form of estrogen or hormone replacement therapy. Or if you're just having vaginal dryness, which can sometimes increase the rate of UTIs, your doctor will prescribe just a vaginal estrogen cream. So instead of having it go kind of systemic throughout your whole body, if you're just having problems in your vagina, then a cream may be more appropriate for you to help.
You talked earlier about how people were scared that it was going to cause cancer. Does it increase your risk for breast cancer?
There is a very slight increase risk of invasive breast cancer. So I like to think of it as if you take 1,000 women who are on hormone replacement therapy for menopause, compared with placebos, 2.5 more women will get invasive breast cancer than those who are just taking placebos. So, 2.5 women out of 1,000 women will get breast cancer where they might not have otherwise gotten it. So yes, there is a very slight risk. However, for many women, the benefits outweigh that risk.
So if you have family history of breast cancer, would that factor in? Would you have that increased risk then?
Yeah, I definitely ask about family history of breast, ovarian, and colorectal cancer and pancreatic cancer. A lot of times because those ones are genetic and may warrant some genetic testing for further workup before starting an estrogen type therapy. But it's not an absolute contraindication. It doesn't rule it out entirely right off the bat.
And that's why it's important to get your yearly screenings. If you catch it early, it's that much more
Mammograms
likely.
are very important.
Yeah.
Preventive care.
Just had to put that
Colonoscopies.
plug in. A lot of women don't get their yearly mammograms. It's free. And it takes 2 seconds. Just kidding. It doesn't take 2 seconds. It takes about 15 minutes.
Yeah.
And once a year. And you could potentially catch your breast cancer early. So
and that's an important part of if you are taking hormone replacement therapy for menopause, it is very strongly encouraged that you get your mammograms each year. Again, due to that very slight increase, but it's good practice either way.
Does it put you at a higher risk for stroke, blood clots, things like that?
Yes, there is a similar to breast cancer, there is a slight increase, about the same actually. So per those 1,000 women, 2.5 women more will develop heart disease, and 2.5 women will develop a stroke. So it's not only important to talk about your family history, but also your personal history as well. Your doctor may want to check a couple of levels, including your cholesterol, your A1C, and estimate what your risk of heart attack or stroke is in the next 10 years.
Yeah.
And if you are at a high percentage, then maybe we look at non-hormonal therapies that might be a little bit more appropriate for you.
How long is it actually safe to be on hormone replacement therapy?
General guidelines typically recommend 5 years or at the age of 60, whichever one comes sooner. But again, this is something that you can talk with your doctor and understand what the risks are versus what are the benefits that you are having from this hormone replacement therapy. After 5 years, they will try and do a slow taper off. And if your symptoms come back, and we can say, okay, well, let's try it for another couple of years. Because in reality, these menopausal symptoms can last for anywhere from 10 to 20 years. And so for some women, 5 years doesn't get them kind of over that hill of having symptoms, and they need it a little bit longer. So I'd say it's a more of an individualized discussion and talking with your doctor and understanding what risks there are as you get older, and whether they or when they outweigh the benefits.
There's a couple different ways that they can do it, right? There's patches, there's pills.
Yeah.
Is there a way that you've found is better?
Yeah. So just like birth control, there's a lot of different formulations or a lot of different ways that are out there. I would say from my practice and those that I've observed in others, typically providers will go more towards transdermal, or basically a patch, just because it has a little bit lower risk of heart attack, stroke, blood clots. So they'll do a patch for estrogen, and then if you still have a uterus, it's important that you also take progesterone at the same time to prevent endometrial hyperplasia, or basically the tissue in your uterus growing too quickly and putting you at risk for endometrial or uterine cancer.
Okay.
So typically I see a patch for the estrogen and then a pill for the progesterone, but you definitely can do a pill for both estrogen or progesterone. And there are variations where you can take them daily versus a couple days a week versus take them about 3 weeks and then take a week off. You know, there are many different variations in how you can take it, but I typically see either a pill for both or a patch and a pill.
So if a woman has had a hysterectomy, can she still do hormone therapy?
Absolutely. You know, for those who still have a uterus or have not had a hysterectomy, we typically recommend, well, we always recommend taking progesterone along with estrogen. However, that progesterone is not needed if you have had a hysterectomy, because if you don't have a uterus, there's no risk of uterine overgrowth, turning into uterine cancer. Those who have had what we call, sometimes referred to as a full hysterectomy, or those who remove their ovaries as well, actually are probably going to need to be on a higher dose of those hormones, because, you know, the main source of their body that made the estrogen has now been taken out. And so they might require a little bit higher dose than other people.
So is it safe to take hormone replacement therapy with herbal supplements or any other treatments?
Yeah, I would say it's always best to talk with your doctor about what herbal supplements you are taking. But there are many herbal supplements that would be safe with estrogen or progesterone or hormone replacement therapy.
So if a woman maybe is skeptical or doesn't want to go the hormonal therapy route, is there any other treatment options for women?
Of course. There are many different treatment options, and it mostly depends on kind of what are the main symptoms that you're dealing with, you know? If your symptoms are, hey, I'm feeling very depressed and my mood is a little bit unpredictable, maybe we talk about having a SSRI or a medication that can gear more towards that. You know, if you're just having vaginal dryness, okay, let's think about just doing an estrogen cream or a moisturizing cream. You know, so there are definitely non-hormonal options out there. Choosing which one would depend on what symptoms you're having to deal with.
Is that kind of more like treating the symptom rather than like the actual issue?
Yeah, I would say
like more putting like a Band-Aid, but like
I wouldn't say it's necessarily putting on a Band-Aid, because your body's going to go through this process either way. And so even with the hormonal therapy, it is treating the symptoms. You know, it's not dangerous for your body to not have extra hormones when going through menopause, but it causes these symptoms that are very unpleasant. And so even, you know, the estrogen, the progesterone are in a way treating the symptoms as well, because they're trying to help decrease those hot flashes or vasomotor symptoms. They're not just trying to get your estrogen at a certain level per se.
So once you start hormone therapy, how long does it usually take women to see results?
You know, I would typically be expecting results 3 to 4 weeks. If you're not having the results that you want, I would go back, talk with your doctor, and your doctor will probably suggest having a check-in about this time anyways, because it may indicate that you need a higher dose than what you're currently on. So I'd expect 3 to 4 weeks.
So what are the side effects that you should expect early on?
Yeah, so some of the most common side effects are kind of breast tenderness, sometimes headaches, vaginal bleeding, or some mood swings based on the type of progesterone that you're on. But, you know, some of these can be mitigated with using the lowest dose that you need instead of being on higher doses. For example, you know, lower doses of estrogen kind of minimizes the side effect of breast tenderness. Vaginal bleeding usually is temporary or transient and will stop after a couple of months.
Once you stop the hormone therapy, can you expect the symptoms to come back?
There is definitely a possibility of the symptoms coming back. Hopefully not as severe as they were before. But we do try and taper off the medication slowly to minimize those from coming back very quickly. So there is a risk of it, yes, but it hopefully can be minimized.
When you're on this therapy, how often should you get your blood work or your labs done?
So we don't typically monitor levels for estrogen or progesterone, because once again, we're not trying to get your body at a certain level per se. It's more of checking in at least annually to see, is this working for your symptoms? Your doctor may check other labs such as your cholesterol, your A1C, or other levels that estrogen therapy can impact to make sure that your triglycerides aren't rising way above normal, that you're not having kidney or liver disease, but you're not trying to check an estrogen and a progesterone to get it at a certain level. It's your dosing should be based on symptoms and what dose is appropriate and will kind of help with your symptoms versus reaching a certain level.
I really thought that they were checking and trying to get you in a level, so that was something
Yeah.
new I learned today.
But that makes sense, though. They're just trying to get your symptoms.
Yep. This is all for symptoms. So let's treat the symptoms.
As we finish up, I just want to give you the opportunity to give your tips on like what a woman's first step should be when they're seeking hormone therapy.
Yeah. I mean, I think the first step is to realize that there are treatments out there that can help and that they are safe to use. So I would talk to your primary care provider first and see if they are comfortable. If not, feel free to come see me. I'm happy to help manage this part of your life. Or your doctor can refer you to another provider that might be comfortable as well.
Thank you so much for coming on today. You've truly inspired me because I am of a certain age to go get some of these things checked out so that I can maybe transition into that era a little less symptomatic.
Yeah. No, thanks for having me on. It's something that I'm passionate about and hopefully can inspire women that they're not alone and that there are treatments out there. So come talk to your doctor.
We highly recommend that if you are interested in hormone therapy, that you find Shelby and make an appointment with her. She would love to see you and work through those issues with you. If you want to follow us along on our journey, please follow us on our Tanner Clinic social medias, Tanner Clinic on Instagram, Facebook, YouTube, and all of our different platforms. You can ask us questions for our future episodes, and we'll answer your personal questions here with our doctors. So follow along with that, and we will see you next time.
Disclaimer. The information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal health care provider.